Hi, Blanca.
Hey, Bertha.
Hey, so I'm going to be doing the elbow coaching with you today on the screening process.
Sounds good to me.
Okay, I have a standard of work here for you. Would you like to review it before?
Oh, no, I'm comfortable with that procedure.
So just during our elbow coaching, I will be correcting you if I see that you miss a step or if there's a safety issue during patient care.
Okay. So I will mark the patient on the metrics. I will bring the patient back to get them to review their history and to go over and have them gown up, and I'm going to mark it on the metrics.
Okay, let's get started.
All right, and then I'll go get the patient.
Okay.
Hi, Jane.
Hi there.
So like I said, my name is Blanca. I'll be doing your mammogram.
Okay.
Can you just tell me your last name and date of birth?
Jane Doe. I was born February 10th, 1977.
All right, and then this is Bertha. She's going to be observing today.
Okay.
So we're just going to go over some information. Can you tell me who your doctor is?
Dr. Smith.
Perfect. So he'll get a copy and you'll get a copy as well.
Okay.
Have you had any prior mammograms?
I have not.
All right. Any current breast problems going on?
Nope, not that I know of.
All right. Have you ever been diagnosed with any breast cancer?
Nope.
Any endometrial or ovarian cancer?
Nope.
All right. And have you had any breast biopsies?
I have not.
Any other breast procedures, augmentation?
Mm-mm.
All right. Have you had a hysterectomy or the ovaries removed?
No, I. Mm-mm.
Okay. And are you doing your monthly breast self-exams?
I am.
Oh, and are you taking any hormones?
I'm not.
Oh, perfect.
Blanca, I noticed that you forgot to do the family history. Can you review that, please?
Oh, yes. And do you have any family history of breast cancer?
No, not that I'm aware of.
And any family history of ovarian cancer?
No.
Okay, so we're just gonna go ahead and go into the exam room and do your mammogram. So since it is your first mammogram, we're gonna take a minimum of 4 pictures,
Okay.
2 on each breast. It's not always the most comfortable, it's different for everyone. And just to let you know that you'll get the results usually in about 7 to 10 days. And your doctor's office gets the results in 24 to 48 hours.
Okay. Do you guys mail those to me?
So it depends. Are you familiar with our K-chart?
I am.
Okay, so if you have access to the K-chart and you access your results within 3 days of those being posted, and they're usually posted just as soon as the doctors are posted.
Okay.
So if you access those within 3 days of them being posted, it will send out a notification and you will not get the letter in the mail.
Oh, okay, great.
Yeah, it's pretty quick and it's pretty
That
awesome.
sounds good. Yeah.
All right, so we'll just go ahead and head into the room and then we'll get started with your mammogram.
Okay, sounds good.
Any other questions?
Nope, not yet.
All right, perfect. All right, Bertha, so I'm just gonna put the pad on the machine, get the patient's information pulled up, get logged in on the Hologic, and then I'll bring her in, verify her date of birth and her last name, and get her mammogram started.
Okay, that sounds great.
Okay. Jane, are you ready? Okay, right this way. We're just gonna come right over here. So I'm gonna have you just step forward here. So we're gonna start with the right breast, but first I'm gonna have you go ahead and tell me your last name and date of birth one more time, okay?
Jane Doe, 2/10/77.
Perfect. Okay. So I want you to just relax, okay? So we're just gonna start with the right breast. I'm gonna be giving you some breathing instructions. It's very important for you to try not to move. So I'm gonna have you step a little bit towards me. And we're just gonna lean into the machine here. Compression's coming down. Let me know how you're feeling. If it feels too tight, just let me know, okay?
That feels comfortable.
Okay. It won't be very comfortable. I'm gonna compress a little bit more, okay? But I don't want it to be painful. All right. Just try not to move. Take a breath and hold it. Breathe. Take another breath and hold it. Go ahead and breathe. All right, you can relax and step back. We're gonna also get a side picture. You're doing great. We're gonna bring this arm up. I'm just gonna have you lean in. Go ahead and step forward a little bit. There you go. I'm gonna bring the machine up a little bit. We're just gonna lean in. There you go. You're like a natural at this.
Oh boy.
You sure you haven't had a mammogram before?
Yes.
All right. Now, once again, I'm going to give you the same breathing instructions. Make sure not to move.
Okay.
Chin up. Take a breath and hold it. Breathe. Take another breath and hold it. And breathe. All right, you can take a step back. So like I said, the results will be posted in your K-chart. You're gonna also get that, your doctor's office will get the results in 24 to 48 hours.
Okay.
And because you are a baseline, there is that higher chance of you getting a call back. So just keep that in the back of your mind in case you do get called back for extra images or for an ultrasound.
Okay.
All right,
Good
so
to
don't
know.
be too worried if you get called back.
All right.
So I'm gonna take you back so you can get dressed and then I'll show you the way out.
Okay.
All right, thank you.
Hi, Blanca. How do you think it went today?
Well, I realized that I forgot to ask the patient about her family history.
Yeah, I noticed that too. What can I do to help you with that?
Well, I was wondering if the step is missing out of the standard of work.
I'm gonna go ahead and check to see if that step is in the standard of work. Ooh, you are right. It's not there.
So I was thinking I could write up an STP card and maybe we can add that step in there.
That would be great because that will help me remember to update our standard of work, and then I can provide you a new copy and also provide it to the other technologists so they can be more successful in this process.
That sounds great.
You did an awesome job. Great job with the patient care and remembering all the steps that you need to follow with our standard of work.
Thank you, Bertha, for helping me be successful.
Any questions?
Yeah, so is it better for me to walk the patient out or should I just tell them like how to get out of the building?
Well, that depends on the patient. If you feel comfortable showing her her way out, then that would be great. Or if you think the patient needs help walking out, that would be awesome if you can walk her out.
Okay, so like when they have a walker or wheelchair, just help them out, and then like patients that are walkie-talkie will just give them directions.
Yeah, that
Okay.
would be great.
Perfect.
Thank
Thanks.
you.
Thank you.